Welcome back to the show. As you know, we have a great relationship with the Royal here at Rogers TV and Daytime Auto. We've had them quite often on the show, in particular during Mental Health Week, but they've got so many exciting things going on, and one in particular that was just launched on May the 30th, and I'll let my next guest tell you all about it. I'm joined by Dr. Jennifer Phillips. She's the Interim Scientific Director at the Royal. Welcome, Jennifer. Great to have you here.
Thanks for having me.
So, Dr. Phillips, this is called the BMO Innovative Clinic for Depression. I mean, the BMO part is pretty obvious. They obviously made a very generous donation, but talk about this clinic and what it means to this community.
Yeah, so we know that there's been underinvestment in mental health care and research for many, many years. So we're very, very excited about this investment from BMO. And we've been able to open a new clinic that's particularly focused on people with difficult to treat depression.
Okay, and by that we mean what? How would you describe that? I imagine it's different for every individual, of course.
Of course, but likely most people are familiar with depression. In fact, about 1/3 of people with depression, when they take conventional antidepressant medications, actually their symptoms don't get better. So they may try multiple different medications and still not get better. Once somebody has tried at least 2 medications and their symptoms are persistent, then we generally consider that to be difficult to treat depression, or sometimes called treatment-resistant depression. So they may need a different type of treatment.
So yeah, what would that treatment then look like? What is the next step after, those difficulties occur?
Yeah, so there's many different options, but in our clinic, the first treatment that we are sort of initiating is called S-ketamine.
Okay.
Yeah.
S-ketamine, and that's a type of therapy.
It's actually medication.
Right? Oh, it is. Okay.
Yeah, it's a form of ketamine, which has long been used to induce general anesthesia. So you may have had it during surgery or for pain relief. For depression, it's been discovered that using very small sub-anesthetic doses is able to very rapidly reduce depressive symptoms. So S-ketamine is a new form of ketamine, which can be administered as a nasal spray, so something you might have seen for allergies or something similar, and we administer that under medical supervision at the Royal.
And so I guess like any medication, when it comes to depression, then you find the right level of it? Is that...
The dosage is pretty standardized, but what we're doing is providing it as part of a comprehensive treatment plan. So people can continue to take their oral antidepressant medication, they can continue their psychotherapy, and this medication we think will kind of boost what they're already doing. Okay. So it actually works differently than other antidepressant medications, rapidly increasing something called neuroplasticity. Right. So the brain's ability to make new connections and new pathways that can support recovery from depression.
So outside of that, what else does this new clinic offer?
Well, so far that's what we're offering.
That's it right now. Okay.
Yes.
Okay.
But
gotcha.
what's unique is because the Royal is an academic hospital, we're actually able to integrate research directly into the provision of care. So when you're translating a new medication, this medication was approved by Health Canada in 2020. So S-ketamine is new. We're translating it from clinical trials, from research setting into regular care. So there's still questions. So we want to know, who does this work best for? How can we use this medication to maximize and prolong its effects? And how do we use it in association or conjunction with existing therapies that we might use for depression?
So what do we know so far? I mean, since it's been around I know the clinic's new, but since it's been around for 2020, what has research shown us?
So research has shown us that this is working for more patients with depression than conventional medications, and working much faster. So people who haven't responded to other treatments, sometimes for several years, will maybe respond to this treatment.
Interesting.
Yeah.
You had the big launch on May 30th.
We did.
Tell me about that, because that's always an exciting time for yourself and the rest of the team, right?
Yeah, so it was wonderful to have a celebration again for this investment in mental health care and research, which we don't always see. So yeah, really exciting partnership with BMO, and really nice event that we had at the Royal with a panel to discuss, as we are here, difficult to treat depression and what this new treatment might bring.
How generous was this donation?
It was a $2 million donation, which I believe is the largest corporate donation to the Royal in its history, actually.
Did BMO tell you why they decided on this? Because, they could donate, I mean, there's a lot of different organizations and causes out there.
Absolutely. Well, we know that the future of mental health care will be shaped by research and innovation, and I believe that is driving their commitment to innovation and to improving mental health for the community. They spoke at the event of being a microcosm of society in their company, in that they have so many employees. We know that anybody can have struggles with their mental health. So really, it's a cause that could touch everyone.
Scientific Director, tell me about that role. What role do you play?
So I'm the research lead within the S-Ketamine Clinic itself, and I'm also the Interim Scientific Director at the Institute of Mental Health Research. So we are a team of scientists that are working in mental health, trying to find new solutions for better treatments, diagnostics, just trying to improve the delivery of care and make new discoveries.
Health Canada approved this in 2020, but you give people an idea, because medications like this, it's not like, oh, we looked at this for 6 months. To get to the point where it is now, how long of a process can that be?
Absolutely. So there is another form of ketamine which is delivered intravenously, like an IV. There's probably 20 years of clinical trials that were done in intravenous ketamine, including at the Royal. We did the first clinical trials of that medication in Canada, leading up to the approval of this intranasal formulation.
Okay.
So yeah.
So is this how it often works then? There's probably other treatments that are being looked at right now by Health Canada and that are being brought forward. We may not see it in 5, 10 years,
hopefully.
right?
Hopefully I think as well, this new type of medication, completely different class of medication, really opened possibilities, I think, in the future for additional treatments. There was a long time where there were not a lot of new treatments available for depression.
So fair to say this is a breakthrough?
Yes.
Right?
Yes.
Because it's going to probably move forward a lot of different treatment options. Dr. Phillips, really appreciate the time today, and congratulations. I mean, this is huge for our community and, of course, for you in the scientific community as well at the Royal.
Yes, thank you so much.
You're very welcome. Again, you want to find out more about the Royal and the wonderful work that they do, you can head over to their website, theroyal.ca. We'll be back with more right after this.